Proper oral hygiene is an essential part of our life, and it's a very important thing for your bright, healthy smile, but brushing your teeth can help fight other diseases as well. So you want to be sure you're going to get it right. And Dr. Martin Goebbel of Southern Blvd Dental is here once again to show us the do's and the don'ts of brushing and flossing. Good morning once again, Dr. Goebbel.
Good morning.
Great to have you back. And you know, last week you and I talked a lot about brushing, but we never really got a chance to talk about flossing. And flossing is a really big part of the dental hygiene regimen. So first and foremost, who needs to floss?
Anybody that has teeth.
That's a good answer, and that means all of us, all of us. So why? What's the reason? I mean, what's the point of flossing other than getting something out of your teeth?
Well, when you brush your teeth, your front teeth are very narrow, cheek to tongue side. Your back teeth, as you go further to the back, the width gets bigger. Well, the brush doesn't go in between. So you need some kind of a means to clean that area.
Okay.
The best thing is floss.
Okay.
And when you go to floss, you need about 18 inches to do your whole mouth. It's best if you just wrap it around the middle finger of one hand and one time around the other side,
so that's the
and leave about an inch between.
Now, is it best to brush before or after flossing? I always do it before.
What you should do is first rinse your mouth thoroughly with water. Then brush your teeth. Rinse again with water.
After you brush? After you brush.
That's going to remove all the stuff that you've loosened up.
Got it.
Then go in and floss. And then rinse again.
Okay, good to know. Okay, so let's get a sample of the right way to do it.
Well, when you floss, to get it between the teeth, you need to work a seesaw motion. Once you're through, then you want to wrap the floss. If you're doing the front of a tooth, you want to push the floss toward the back and pull up. Go through. If you're doing the back of a tooth, wrap forward. It's what we call C-flossing.
C-flossing.
In other words, your tooth is kind of cylindrical. And because it's not square, going straight up and down doesn't catch all the parts.
Good point. Well, let me ask you this. What if you have any kind of caps or any kind of, you know, anything that's not your real teeth? Is it dangerous to go in and out, or do you have to like slide through? Do you know what I mean?
If the teeth, the crowns or the veneers are on properly, flossing should not mess with them. Okay.
Good. Good to know.
When you have a bridge, you obviously, if you thread the floss, you use like a giant plastic needle and thread the floss underneath the bridge, floss back and forth underneath the artificial tooth, then you've got to pull it out sideways. There's no way to get it up the other way.
Now, I floss twice a day. I don't know if that's bad or good. How many times a day would you recommend?
Once or twice.
Okay.
And again, the most important time is before you go to sleep.
Okay, yeah, because that's after you've been eating all day. And
right. During the day, you eat, you drink, you talk, there's motion in your mouth.
Good point.
Things get moved around. At night, anything you leave there, your gums react like a cut on your finger would.
Good point.
Okay? If you get dirt in a cut and leave it there, it gets inflamed, it gets irritated, it gets infected, it bleeds, all that stuff. Now, there are brushes that will work. And these brushes are called Proxa brushes. They kind of look like a little Christmas tree. And these work in places where there's been some gum recession. So you've got more gaps. A brush is always even better than floss because it hits all parts of the tooth. And you just work it through between the teeth to clean there. Brushing your tongue, we talked a little bit about last time.
Yes,
we did. Or cleaning your tongue.
You said it was, it was a pretty bad picture, thinking of it as a rug.
Your tongue looks like a shag carpet.
Yeah, I don't want to think of it as a rug.
And the slide that was just up were tongue scrapers. Well, if you don't loosen the stuff down at the bottom with a brush, and you use a tongue scraper, you're going to get some of it, but not all of it. So I recommend that you use a toothbrush, a manual brush. Not an electric.
Well, what about water picks?
Water picks work great. To remove the debris that you've loosened up.
After you've loosened it up then.
Yes. There's a variety of them. Some connect to the faucet, some are freestanding. I recommend what's called the HydroFloss.
What's that?
It is a water pick that ionizes the water as it comes out of the thing, the nozzle. Ionizing again, bacteria are negatively charged, and if you hit them with this ionized water, it helps to loosen them from the surface of your tooth.
That's a good point.
When you use a water pick, you should always just aim it at the teeth, pretty much at a perpendicular angle.
Okay.
You don't want to shoot it up in between the tooth and gum. You will actually drive debris further in.
Really?
Now you can use it on the gum surface itself on a very low setting, going around the gum to stimulate it. That causes increased blood flow in the gum, and the other thing that you can use to massage the gum is what's called a rubber tip.
And you can buy these at any store?
They're just about everywhere.
Okay, good. Well, let me also ask you this while you're doing that, because one of the questions I know a lot of people out there have are about toothpaste, because there's so many choices. How do you make a decision? How do you pick?
It depends what you want to do with the toothpaste.
Okay.
There's whitening toothpaste, there's desensitizing toothpaste, there's toothpaste that will help prevent plaque formation. That is a decision that probably should come from your dentist or hygienist.
Okay.
What your condition is will determine which toothpaste would be best for you.
Interesting. Well, what about the ones that say they do everything? I mean, do they really?
They do everything, but not well.
Yeah, because there's not one particular focus.
Right.
So if you were my dentist, would you would make your recommendation based on my particular needs, not just in general?
Right.
Okay.
There isn't one toothpaste that's best for everybody.
What about mouthwash and rinses? Is there one in particular?
I like closest. I do not like anything that contains alcohol.
Okay. That's right, you have said that.
Pro Health is by Crest. Closest is their own brand. Closest has no alcohol, neither does Pro Health. The one on the upper right is Pyridex, which is by prescription only. It's actually a soap.
It's a soap. So when your mom says wash your mouth out with soap, you literally do?
You literally do when you use the Pyridex. But it is prescription because it is for the more advanced cases.
Okay.
The problem with Pyridex is that it leaves a stain on your teeth.
Ooh, well, why would you want that?
Well, you're controlling the bacteria.
So again, we always say balance. It's give and take.
Right.
It's just a matter of the choice. Well, fortunately, if you have any dental needs and you go to Dr. Goebbel, he'll be sure to give you his personal recommendation on what works best for your personal needs. So let's tell all our viewers how they can find you at Southern Blvd.
2716 Southern Boulevard Southeast up in Rio Rancho. Phone number is 892-8600.
Perfect. And I will be sure to floss and brush and rinse my mouth with non-soap. I will not be using the soap. I don't want to stain my teeth. Thank you, Dr. Goebbel, so much for all of your help. Always very, very important advice. And we will take it. You take it too, especially if you're eating pie. You'll see what happens when that happens today. Coming up next, what budget busters you can avoid to make your ends meet.